Fast ortho, what is it?
Fast orthodontics is, can I give you another name for it
Sure.
also? It's called abbreviated AOO, Accelerated Osteogenic Orthodontics, but we call it fast ortho.
Okay.
This is a procedure where patients have a surgical procedure performed prior to having orthodontics. The main reason people have orthodontics or braces is to align their teeth, to straighten their teeth, or even their teeth. Orthodontics can typically take 2 years.
Yeah.
Fast ortho shortens this time period in half at least. So a person can have the smile they want in half the time with slightly more cost.
So you work together with an orthodontist.
With our local orthodontist.
And so what would take 2 years can take 1 year. What would take 12 months could take 6 months. It's about half the time.
Exactly.
And it's a lot less expensive, you say, than veneers.
Than veneers.
Because
yes.
they want straight teeth.
They want straight teeth. So if a patient wanted a full mouth of veneers, fast ortho and braces allows them to keep their own teeth and still have the smile they want in a very short period of time.
This is for adults.
This is for adults. It's for teenagers also.
Okay.
But I see the most ideal situated patient is someone probably between age 35 to 75 we've done these patients on.
I asked you on the telephone, I said, who is this great for? And you said people that have jaw problems.
Jaw problems.
Elaborate on that.
Yes, patients
And describe what those would be.
Those jaw problems could be an open bite where they bite down on their back teeth and their front teeth are still open.
Okay.
A cross bite.
What defines a cross bite, by the way?
Their teeth, instead of fitting together, they mesh together well. They kind of fit in a cross situation.
All right, okay.
Underbite, overbite, cross bite, open bite.
So surgically, you what? Help it along?
Exactly. We speed up the process. We soften the bone, and then we add bone so that the orthodontist can move the teeth faster and further than typical.
So adult orthodontics with this fast ortho. So what normally would take years, especially with an overbite or underbite. And I don't want to put words in your mouth, just so I understand this correctly.
Exactly.
Your surgical procedures just make everything happen much faster.
Much faster. Yep. As an oral surgeon, what we always wanted to do when we were training in residency were orthognathic cases. We wanted to do the jaw surgery, to section the jaws, to move them forward, to move them back, to make people look better, to give them a better bite. But no one wanted to go through that procedure. They didn't want to go to the operating room to have it done. Fast ortho can take care of probably a third of those cases, maybe even a half of those cases, and it's done in the office, and it's a much less painful, and patients don't need to have their jaws wired together for 6 weeks after the procedure. One other little caveat is if there's missing teeth, especially in the older population, someone over 35, 40 years of age, is with the fast ortho and the braces, sometimes those spaces can be closed down and the patient doesn't have to worry about having a bridge or implants later on.
So ask you guys about fast ortho.
Correct.